I got tagged in this video a few times, so let's break it down. This is James. He's playing Eat the Bag. Personally, I've never heard of it, but he's in front of all the family members, and he's almost got the bag, and his leg explodes in front of everyone. So they have to call 911, and he gets taken to the hospital where they find out he has a spiral fracture of his femur. Let's slow it down and break it down. So first of all, James, when you're in this position, your pelvis is so pissed at you because your hip is flexed here, it's extended here, and your pelvis is going backwards when your lumbar spine is flexed like that. So you're in this position, your foot is about to come off the ground, and that's a lot of spiral force at your femur, and we'll talk about that in just a moment. That's just unfortunate there for James. He's so close to the bag, he almost had it. So the femur is involved here. It's a spiral fracture, okay? So when he's in this position, this, first of all, peak athletic form for James. So close. So his pelvis, when your lumbar spine flexes and when you're going down to touch your toes, your pelvis actually goes backwards so that it allows for more flexion at your lumbar spine. So he's about maxed out there. This hip is almost fully flexed. It probably is about fully flexed, and you normally have about 120 degrees. So your pelvis is going backwards, okay? And when you go into hip flexion, it's an anterior roll and a posterior glide. So your femur is following that pelvis backwards. And so this ankle is sending a lot of force up through your knee, okay? And this knee wants to go out that way, all right? So your knee wants to go out that way, and it's also keeping your femur locked. And your femur wants to roll with your pelvis. And so when this femur stays locked here at this knee and it wants to roll with this pelvis, it's going to cause that spiral moment, and that is why it fractured that way. So what happened here, and I'm just putting this here to show you a look of the femur at the pelvis. So your pelvis is going to go backwards. The femur is also going to follow it, but it's a really shallow acetabulum. So I'm surprised it didn't dislocate before it's fractured like that. I'm also surprised the knee didn't give out before it fractured like that. But just an unfortunate series of events. So James is actually up and walking around after he had a surgery and put some rods in there. He mentioned that the first 2 days of therapy were not fun. And I'm sorry it'll be that way for a while because this is a serious fracture. At least he's in good spirits. He seems like a pretty nice guy. But he's looking to transfer out of the hospital into a rehab facility or an outpatient clinic. Good luck in your rehab, James. I wish you the best. Probably looking about 8 months, my man.